So it's breastfeeding week on the island, and the big sort of campaign is to improve the rates of breastfeeding on the island and sort of to promote the public side of that as well. So where does the campaign come from?
The World Health Organization, UNICEF, and the World Alliance for Breastfeeding Action all sort of have this vision that we want to reach 70% of women exclusively breastfeeding, because that's been shown to give the best protection for a growing baby. Now, the theme of this campaign this year is about sustaining breastfeeding together, and from a public health perspective, very aware that breastfeeding is a personal choice and not everybody is able to breastfeed. So whilst we're promoting it and making sure that people are aware that breastfeeding is best for their growing baby, we actually just want to build a culture that normalises, supports and protects everyone's breastfeeding choices.
There's an element of this. When we first got this through, I jumped down and went, it's 2025, how is this not a thing? Mm-hmm. Why do you think that is, perhaps?
Oh, I think there are lots of reasons why it might be that people might not feel like they're able to, or people might feel like certain workplaces or places out in public aren't supportive. So it's all around allowing us to like normalise that culture, and that's for everyone. Everybody has a role to play. Partners and families should be offering emotional and practical support to individuals who wish to breastfeed. Cafes and businesses can join our recently relaunched Breastfeeding Welcome Here scheme, and to demonstrate that, just put a blue sticker in the window, which can be supplied by Public Health. Employers should try and provide suitable spaces for breastfeeding women and offer flexible working conditions so women who want to breastfeed are able to. And healthcare professionals as well have a part to play by offering resources and signposting early to our fantastic colleagues in Manx.Care.
With my experience, quite often the reason why we mums struggle to breastfeed is the education. They felt like they didn't know the basics around it. They didn't have the practical skills. So that's where our role as the infant feeding team comes about, because we do antenatal, that's before the baby comes, classes where we can talk about how the theory of breastfeeding, and then also about position and attachment, so the more practical side of it. Then we're on the maternity ward as well, so we can help women there face to face when they've just had the baby, and then also when the babies and the mums are discharged, we also can do home visits, and we can also do clinic visits alongside the midwife. So we try and do like a wraparound care with the health visitors and also the maternity staff. We're kind of like the additional service. We promote breastfeeding and feeding, so we'll help with whatever that looks like and whatever that journey is for that mother.
While you touched upon like there'd be certain people with like medical reasons or personal choices to why it is, the figure seemed surprisingly low when we saw it, and we thought it would have been higher. Why do you think that perhaps is
So our initiation rates are really, really good. It's the sustaining it to that 6 months. We found that lots of women, really get involved and they really want to do it at the beginning, and they have that service, and I think then they ask those questions, but the later on as the babies get older, different questions come and different ways of breastfeeding happen. So it's making them aware that you can still come to our services, you can still ask those questions. We can help from birth until the end of that breastfeeding journey.
Just from a public health point of view, because that talk about developmental growth, and we're big, society sort of switched back towards as natural as things can be, and we're all big on organic foods and everything else. This is literally like one of the most natural processes that humanity has done forever.
Well, I think it's important to point out that our rates, we're not an outlier in any way. This is, across the board. We're basically,
absolutely.
We're in line with England, which is broadly in line with the rest of Europe. I mean, this is an issue which is faced in a lot of developed nations. And I agree. I mean, there is a substantial body of evidence that indicates that breastfeeding is best for the growing child in terms of providing immune protection and good nutrition, but also good for the mother as well in terms of creating that emotional bond with the baby. But I always come back to the fact that I completely appreciate that not everybody is able to breastfeed for a variety of reasons, and in that instance I think that the public health message there is just being fed is best, however is possible for you and for the baby.
And just touch on like with businesses, there's a lot of businesses that, whether it's employees or whether it's cafes, that do promote this, and what more do you think sort of can be done on that, and is it something that is a societal change, or does it perhaps need to go, I don't know whether a little bit further legislative change around that, but
Yeah,
whether
so-
that's something that could be pushed a bit more.
Yeah, so there is legislation in place for women to breastfeed and not to feel like they need to leave. I think it is a society. I think we are in a bottle nation, unfortunately, and I think changing that mindset will help promote women to feel more confident. Quite often women say to me, I was just a little bit nervous to breastfeed my baby in wherever they might be, but now we've got the stickers, which we've had for a little while, but we've renewed it, so it'll make it more of a front to people's mind. I think businesses, things like offering the women, if they want a glass of water, making it a safe space so they know that they can feed. And I think women feeling comfortable in their surroundings is the best way to continue breastfeeding.
In order to do this, obviously it is a societal change, but the key point here is that we want to make the healthy choice the easy choice, and that means that everything that we're doing in terms of this campaign is to make breastfeeding the easiest possible choice for families, be that at home, when you're out and about grabbing a coffee, or you're in the workplace. So there's plenty of resources online, gov.im/breastfeeding or gov.im/sustaining breastfeeding together. If you go to those pages, there are resources for families, for signing up if you're a small business where you want to become a breastfeeding inclusive space, and there's also a toolkit for employers as to how they can make breastfeeding easier for women working in their workplace.
As part of this month, we are actually doing pop-up breastfeeding cafes, which is amazing. So I've got some of the dates here. There's Friday the 8th of August, and that's in George, down south. And then we've got Monday the 11th of August, and that's 10 o'clock in the Derby Health Centre. And then we've got Monday the 18th of August, and that's 10 o'clock, and that's in Davison's Ice Cream Parlour. So that's always a good one. And then there's Friday the 29th of August, and that's 10 o'clock at Noah's Bakehouse in Douglas. So we're trying to make it a safe space for everywhere and throughout the Isle of Man. So there's lots of different places to come. And that's women that are pregnant, people that have had babies, that want to just key in with the breastfeeding. Or if you just have a question, we'll all be there to answer questions.
Just a quick thing I just want to pick up on that, other than the advert of Davison's, which they're going to love. How important can that be for both maybe like first time mothers or expecting mothers, just to be able to speak to people with?
Absolutely.
It's that classic thing, isn't it? You speak to a professional and you go, well, they know what they're talking about. And then you speak to someone who goes, look, I know they're the professional, but this is my experience.
Yeah, exactly. So we have the evidence-based information, and we'll go from that perspective and help as much as we can. But other women having that lived experience is so crucial, and working together is how we get those results.